And suffixes, so connected to the end of a word, right? Algia, pain. Seal, hernia or protrusion. Genic is producing or originating from. Aya or ia, disease or abnormal state. Iatrist is a specialist or physician. Ictal is referring to a seizure. Lysis is dissolution. Malacia, softening. Oma, referring to a tumor or swelling. Paresis is a slight paralysis, and plesia is a complete paralysis. Disease and disorder terms for the nervous system. Cerebral embolism or thrombosis is a blockage of blood flow in the cerebral arterial system, so within the brain, either by a blood clot or some other foreign body, maybe a fat plaque or an air embolism that blocks the blood flow and blood and oxygen delivery to the brain tissue, which can cause tissue death and signs and symptoms of a stroke. Encephalitis, inflammation of the brain tissue. Glioblastoma and a glioma are tumors of glia cells. Glia cells are very numerous amount of cells within the nervous system that supply nutrition and cerebral spinal fluid to the neurons, the actual nerve cells. This is the most common type of nervous system tumor. Hydrocephalus is increased amount of water or cerebral spinal fluid within the brain, puts extra pressure on the brain. Intracerebral hemorrhage is bleeding within the brain, so ruptured blood vessel within the brain, or hemorrhagic stroke. That's also known as a hemorrhagic stroke. Meningitis is inflammation of the meninges, or those protective layers around the brain and spinal cord. This can be a very dangerous infection, difficult to treat. Neuralgia is nerve pain. Subdural hemorrhage is bleeding underneath those dura or those meninges on top of the brain. So you can have a collection of blood, which would be a subdural hematoma. A hematoma is a collection of blood. It's like we're translated specifically like blood tumor, but it's a collection of blood underneath the skin or some layer of tissue. Disease and disorder terms continued. Alzheimer's disease is the most common cause of dementia. Dementia is a cognitive impairment characterized by loss of intellect, reasoning, memory, unable to learn new things, loss of the ability to complete activities of daily living. Alzheimer's disease is the most common cause of dementia. It's fatal diagnosis. People will die from complications of immobility. Lifespan is less than 10 years after diagnosis. Amyotrophic lateral sclerosis, or ALS, or Lou Gehrig's disease, is progressive muscle atrophy caused by degeneration and scarring of neurons along the lateral columns of the spinal cord that control muscles. So people will die from a paralyzed diaphragm and then complications of respiratory failure, typically with ALS. Bell's palsy is unilateral, so one side of the face paralysis. This is typically caused by a viral infection and inflammation of cranial nerve 7. Most of the time, this can be reversed with some antivirals and some steroids and stuff. Sometimes the symptoms will last a long time or they don't go away at all. Cerebral aneurysm is a ballooning of the artery within the cerebrum or the brain. This is typically asymptomatic unless that ballooning or weakening of that arterial wall ruptures. Then you have bleeding in the brain and you'll have a stroke and you could die. Chronic traumatic encephalopathy, also known as CTE. This is what athletes get, like football players, hockey players, anybody who's getting hit in the head a lot, boxers. They'll have all kinds of symptoms like memory problems, cognitive impair, mood or behavioral disorders. Unfortunately, this isn't diagnosed until after they die and we do a brain autopsy. Dementia, we talked about. Epilepsy is seizures, so a condition of having more than one seizure. Multiple sclerosis is chronic degenerative disease caused by sclerotic patches along the brain and spinal cord, fluctuating in signs and symptoms from like fatigue to balance and coordination impairment, numbness, vision problems. This can also end in death from complications of immobility. Parkinson's disease, chronic degenerative disease of the central nervous system. Signs and symptoms include muscle twitching, tremors, gait problems. Even dementia is associated with Parkinson's. Sciatica, inflammation of the sciatic nerve. So pain radiating from the low back down one leg all the way to the foot. Shingles is a viral disease. that affects the nerve path. Blisters usually form over a nerve path, very painful nerve pain. And a stroke. Stroke is interruption of blood supply to the brain. So it can be hemorrhagic or ischemic. So it can be a blood clot or bleeding, which impairs the circulation or perfusion of blood to the brain. And you have all kinds of signs and symptoms, can be deadly. Complementary terms. Anesthesia without feeling or sensation. We think of anesthesia as general anesthesia, which is when a doctor gives you drugs during a surgery so you cannot feel or sense what's going on. Paresthesia is abnormal sensation. Aphasia means without speech. Dysphagia is difficulty speaking. Hemiplegia, paralysis of half of the body. Quadriplegia, paralysis of all four limbs. So this is typically paralysis from the neck down. Postictal is after a seizure. Preictal is before a seizure. Ataxia, lack of muscle coordination. Concussion, injury to the brain tissue. Seizure is a surge of electrical activity to the brain, causes all kinds of different signs and symptoms. Can be shaking of the body is typically what you see. Here are some behavioral health terms you're going to need. A psychiatrist is someone who studies and treats disorders of the mind. They can prescribe medications. Psychogenic is referring to originating from the mind. A psychologist also studies and treats disorders of the mind, but they don't prescribe medications. They'll do psychological testing and counseling and things like that. Psychopathy or psychopathy is a disease of the mind, any disease of the mind. Psychosis is abnormal condition of the mind, extreme derangement, often delusions or hallucinations. Psychosomatic is pertaining to the mind and body. Behavioral health disease and disorder terms. Anorexia nervosa is disturbed body image, fear of gaining weight, malnutrition related to not eating enough. And anxiety disorder, apprehension, tension, uneasiness from anticipation of unreal or imagined dangers. Attention deficit hyperactivity disorder, ADHD, inattention, distractibility, impulsiveness, hyperactivity. A million kids get diagnosed with this all the time. Autism, spectrum of mental disorders. This person has a preoccupation with subjective mental activity, inability to interact socially, impaired communication skills. Bipolar disorder. This is a mental disorder where people have manic qualities, which is like hyperactivity, irritability, elevated mood, and they also have depressive phases where they're very sad, very slow, and they can alternate between manic and depressive, or they can happen at the same time. Bulimia nervosa is an eating disorder characterized by uncontrolled binging of eating. So they eat a ton and then they purge or they induce vomiting. So they throw that food up. So they can also be very skinny, like an anorexic person. Major depression is characterized by feelings of sadness, despair, discouragement, hopelessness, lack of joy, altered sleep patterns, difficulty with decision making and daily function. Typically, this lasts more than a few weeks, and they call it major depression. Obsessive compulsive disorder, OCD, characterized by intrusive, unwanted thoughts that result in the tendency to perform repetitive acts or rituals, compulsions, usually as a means of releasing tension or anxiety. A phobia is a marked or persistent fear that is excessive or unreasonable. Post-traumatic stress disorder is significant behavioral health disorder in which some people are exposed to a traumatic event and go on to develop a series of symptoms related to that event. Schizophrenia, any one of a large group of psychotic disorders characterized by gross distortion of reality, disturbance of language and communication, withdrawal from social interaction, disorganization and fragmentation of thoughts, perception, and emotional reaction. These patients a lot of times will have delusions or hallucinations, detachment from reality. Somatoform disorders are disorders characterized by physical symptoms for which there is no physical cause. So it might be in their head. Abbreviations: AD, Alzheimer's disease; ADHD, attention deficit hyperactivity disorder; amyotrophic lateral sclerosis; cerebral palsy; chronic traumatic encephalopathy; cerebral vascular accident; multiple sclerosis; central nervous system, peripheral nervous system, obsessive compulsive disorder, Parkinson's disease, post-traumatic stress disorder, subarachnoid hemorrhage, SAH, TBI, traumatic brain injury, TIA, transient ischemic attack, CSF, cerebral spinal fluid, and EEG is electroencephalogram. It's a test they do on your brain.